First Aid Nursing MCQs. The first priority in first aid is ensure scene safety. The emergency ambulance number in India is 108. ABC in first aid stands for airway, breathing, circulation. The recommended adult CPR compression to breath ratio for a single rescuer is 30:2. The first action to control severe external bleeding is apply direct pressure. Which method is used for a sprain? Rice. A patient with a nosebleed should lean forward and pinch the nose. Which pulse is checked during adult CPR? Carotid. Which burn is caused by hot liquids? Scald burn. A conscious person with mild choking should be encouraged to cough. An unconscious patient who is breathing normally should be placed in recovery lateral position. The normal chest compression depth in an adult during CPR is five to 6 centimeters. The recommended chest compression rate during adult CPR is (100 to 120 per minute). Which of the following is the most common sign of shock? Cold, pale, clammy skin. The first aid treatment for a suspected fracture is Immobilize the affected part. A snakebite victim should keep the affected limb immobilized. Which of the following should not be done for burns? Break blisters. The first aid treatment for a bee sting includes remove the stinger carefully. Which of the following is a sign of heat stroke? High fever with altered mental status. In poisoning cases, the nurse's first priority is to identify the poison and call emergency services. The first aid treatment for a fainting syncope patient is lay the patient flat and elevate the legs. The best first aid for a nosebleed is lean forward and pinch the soft part of the nose for 10 to 15 minutes. Which of the following is a sign of airway obstruction? Silent cough and inability to speak. A person with severe choking who cannot speak should receive abdominal thrusts, Heimlich maneuver. The first aid for an avulsed, knocked out permanent tooth is store the tooth in milk and seek immediate dental care. Which is the best method to prevent infection while giving first aid? Wash hands and wear gloves whenever possible. During CPR, chest compressions should be interrupted only. Only when absolutely necessary, e.g., AED analysis or rescue breaths. Which of the following is the first aid treatment for a sprain? Rice rest, ice, compression, elevation. The most important goal of first aid is to preserve life, prevent further injury, and promote recovery. What is the first action when you find an unconscious person? Check for response and call for help. Which of the following is the correct first aid for an electrical burn? Switch off the power source before touching the victim. Which of the following is the best first aid for a minor burn? Cool the burn under running water for about 20 minutes. Which bone is most commonly fractured when a person falls on an outstretched hand? Scaphoid. Patient with suspected spinal injury should be kept still with the head and neck immobilized. Which first aid measure is appropriate for heat exhaustion? Move the patient to a cool place and provide fluids if conscious. Which of the following is a sign of severe allergic reaction anaphylaxis? Difficulty breathing with swelling of the lips or tongue? Which dressing is preferred for controlling severe bleeding? Sterile gauze with direct pressure. Which of the following is an objective of first aid? preserve life, prevent further injury, and promote recovery. Which position is recommended for a patient in shock without suspected spinal or leg injury? Lying flat with legs elevated 20 to 30 centimeters. Which of the following is the best way to stop external bleeding from a limb? Apply direct pressure over